Another common hip problem is what would be called a hip flexor or a hip pointer problem. So your hip flexor is a group of muscles that run in through the front of your hip. Their job is not only to lift your leg, but the job of the hip flexor is to make sure that the head of that ball in that socket is not pulled too far forward. When it's pulled too far forward, either because your hip flexor is too tight, which is typically the case because we spend so much time during the day sitting nowadays, that hip flexor tends to shift the ball closer to the front of the socket. The ball, when it shifts closer, it starts to pinch up against the front of the socket, and you'll get that deep pain kind of right in through the front of the hip. Typically it'll start out, it's there just when you're walking, it's there mostly when you take a step, because as you take a step and it shifts forward, you get that pinch. But as the problem progresses, it'll start to be there just when you're standing, let's say at the sink, brushing your teeth or washing dishes. It'll be there when you're standing in line. As it gets even more progressed, it'll be there when you sit, because as you sit, the front of the hip is actually impinging against the front of the socket, creating that pain. Now that doesn't always lead to labral tears, but it can lead to a labral tear, which is another common problem that we see. Remember, the labrum is that cartilage that extends off of the edge of the socket that acts as the suction cup to pull the head of the femur in. That labrum over time is a very thin, very weak structure to start with, and it just takes a lot of undue stress. So anytime anything in our hip isn't working properly, ultimately the labrum is trying to create more suction, so it's having to work harder. But if I had a hip flexor problem, it definitely becomes an exacerbator of a potential labral problem. But labral problems can occur just on their own as well. And so that labrum starts to wear out, it starts to develop a hole in it. And just like a suction cup that doesn't have the ability to create suction because there's a hole in it, now all of a sudden if the labrum can't create suction anymore, the head of the femur starts to sag down out of the socket some because some of that suction is lost. Well, what does that mean? Now that means all of the other muscles of your hip have to work harder to compensate for that. They have to start doing things that they normally wouldn't do. They have to, instead of pulling it out, they have to start working on pulling it in, which makes muscles tighter. Muscles being tighter creates more friction in the joint, and the problem kind of keeps going. How can PT help? Well, there's really two factors. One is, if you're not having any hip problems currently, now's the best time of all to get your hip checked out. Because every time you move in and out of a chair, up and down stairs, walk, etc., every time you're standing, you're relying on your hip joints to work perfectly. If you're not having problems, well, obviously they're working well. But you, just like your car, you get it tuned up, you get the oil changed, etc., you want to make sure that certain things aren't beginning to happen in and around your hips. Mostly that glute weakness, that hip weakness, that allows certain problems to get started. Now on the other side, if you're having hip problems or you've had hip problems in the past, now's the time for an expert physical therapist at Loudon Sports Therapy Center to do a full evaluation of your hip. Find out what's going on with the mobility. Where are things flexible? How is your joint moving? Does it stay open when it's supposed to stay open? Is the integrity of the joint being protected? What's going on with the labrum? What's going on with the muscles? And what needs to be done for your hip versus what the internet tells you is good for everybody's hip? And what needs to be done with your hip to get that problem taken care of